Good afternoon, everyone. My name is Nicole Corsi. I'm the Deputy Director of Programs at Well Ahead, Louisiana. I would like to welcome everyone to today's webinar on childhood obesity. Just some housekeeping before we get started. I want to remind you to mute your microphones as we move through the presentation. We will be holding all questions until the end of both presentations, but please feel free to go ahead and put your questions in the chat as the speakers move through their slide deck. Again, a reminder to mute your microphones. First, I would like for Ms. Avis Richard to jump on and give us some welcoming remarks.
Good afternoon and welcome everyone. My name is Avis Richard. I'm the Director for the Bureau of Chronic Disease Prevention and Healthcare Access. We are branded as Well Ahead, and Well Ahead to us is our strategy to keep health moving forward. And to move health forward, obesity has been an overarching issue, not only for our state, but worldwide. And to combat that, we definitely need comprehensive strategies with our partners and organizations to help manage and put forth effective and sustainable strategies in the management of obesity. Those health impacts caused by obesity are wide-ranging and include things like diabetes, cardiovascular disease, depression. You will hear from two dynamic speakers today who will talk about the impact of obesity on children and their issues that come up, including things like anxiety, depression, and even bullying. We at Well Ahead have put together a comprehensive strategy called the Chronic Disease Collective. And it's our approach to improve health outcomes, specifically around obesity, diabetes, and cardiovascular disease. But today we're focused on kids, and through our speakers, we're going to learn more about the impact and then also what we can do to combat some of the more negative outcomes that are associated with this. And with that, I'd like to turn it back over to Nicole Corsi.
Thank you so much, Avis, and thank you for hosting these sessions. They really are informative and very helpful. Okay, let me just a reminder to mute your microphones as we move through the slide deck. First, I would like to introduce Ms. Stephanie Hackett. Stephanie is a dedicated public health professional working to improve the health of children and adolescents in Louisiana. As the school health program manager at Well Ahead, Louisiana, she collaborates with educators, public health organizations, and community stakeholders to promote wellness and healthy behaviors among students. Stephanie holds a bachelor's degree in nutrition with a concentration in dietetics. Prior to joining Well Ahead, she served as healthy eating educator for Whole Foods Market in Metairie, Louisiana, where she spearheaded community engagement efforts through healthy cooking classes, consultations, and healthy challenges. Passionate about fostering a healthy school environment, Stephanie is committed to empowering students and educators alike, ensuring that all children have access to the resources they need to thrive. In her free time, Stephanie enjoys reading, poetry, and visiting her local farmers markets. Welcome, Stephanie.
Thank you, Nicole. Can you hear me okay? You can hear me okay, right?
Yes, Stephanie, we hear you.
Yes, we sure can.
Okay, great. Okay, so like Ms. Avis mentioned earlier, we know childhood obesity is a health concern nationwide, but let's talk about the prevalence here at home. This data is from the 2023 Youth Risk Behavior Survey, which is administered every other year in Louisiana. And in 2023, it was found that 36% of students in Louisiana have a BMI indicating overweight or obesity. And it's actually split pretty right down the middle. That's 18% overweight and 18% obesity. And for reference, this number was the same in 2021, but it is up slightly from 35% in 2019. Next slide. So being overweight in childhood and adolescence affects children's immediate health and is associated with greater risk of earlier onset for various non-communicable diseases like type 2 diabetes, cardiovascular disease. But it also puts children at risk for psychological conditions like bullying, low self-esteem, and anxiety. And we know that mental health is increasingly becoming a concern for youth. Children with obesity are also very likely to be adults with obesity and are at a higher risk of developing those types of non-communicable diseases in adulthood. Next slide. In addition, the Youth Risk Behavior Survey in Louisiana showed that students affected by overweight or obesity report poor academic achievement at higher rates. So, and there's ample research out there that shows a strong connection between healthy behaviors and academic achievement, like grades, standardized test scores, attendance, even graduation rates. This is important to note because we also know that people with higher levels of education are more likely to be healthier and live longer. Access to quality education is one of the social determinants of health. So educators have a stake in the health of their students because it helps them perform better academically. And public health professionals have a stake in students' academic achievement because education supports lifelong health. Next slide. And of course, there are many factors that contribute to childhood obesity, and we can't change genetic factors. But people and places can play a role in helping children achieve and maintain a healthy weight. Changes in the environments where young people spend their time, like homes, schools, and other community settings, can make it easier for youth to access nutritious foods and be physically active. And at Wellhead, Louisiana, we have many programs that promote policy systems and environmental changes to help make healthy choices easy and accessible in those places where children spend their time. Next slide. So let's talk about early childhood. Early care and education facilities, also known as ECE facilities, like child care centers, are ideal places to encourage healthy eating and physical activity. The ECE setting can directly influence what children eat and drink and how active they are, and that builds a foundation for healthy habits. This is the CDC's Spectrum of Opportunities framework. It was designed to help identify obesity prevention policies and activities that can be embedded into ECE systems. It describes 9 areas to consider as states and local communities work to improve ECE policies and practices. I'm not going to go through every one of these 9 areas today for time, but just to give you some examples of strategies that can support the spectrum of opportunities. ECE facilities can use tools like Go Knapsack to assess, plan, and implement evidence-based interventions. Go Knapsack is an online platform that walks childcare providers through 5 steps to make healthy changes to their programs. Another example would be Farm to ECE, so like a farm to school program, but in the early childhood setting. And Farm to ECE can provide increased exposure and access to local produce, also opportunities to learn about nutrition and hands-on learning. Next slide. Schools also have a role. Schools have direct contact with youth ages 5 to 17 for an average of 6 hours per day, and during some of their most critical years of development. So schools can have really help students establish lifelong healthy behaviors and grow into healthy, successful adults. This is the whole school, whole community, whole child model. It's a framework for addressing health in schools, and it emphasizes the importance of evidence-based school policies and practices. It actually addresses not only physical health, but mental and emotional health as well. And as you can see, the model has 10 components in blue. At the end of my slides, there's going to be a slide with resources and a link to CDC's website. They have a really cool virtual healthy school where you can see the WISC model in action. But some examples that I'll mention now are when it comes to the school nutrition environment, providing healthy foods and beverages at school celebrations and events, and a big one, offering non-food items to reward or incentivize students for good behavior or academic achievement. So rather than giving students candy to help motivate them or reward them, thinking about something that's not food related to reward students with, like extra time at recess or, getting a special job in class that day. Schools can also promote more physical activity for students throughout the school day, whether that's in classroom, like movement breaks in the classroom with your teacher, or opportunities before school and after school. And the CDC has a tool called the School Health Index. It's a self-assessment and planning tool for schools they can use to identify different strategies and these different components of the model that they can implement in the school setting. Next slide, please. But what about the rest of the time, right? Childcare facilities and schools are only pieces of the local communities surrounding them. But communities have opportunities too. Through strategic community design, communities can connect activity-friendly routes to everyday locations, providing safe and accessible spaces for youth to be physically active. Safe Routes to School and Safe Routes to Parks are two national programs available to local communities to help make safe physical activity opportunities accessible to their residents. Next slide, please. And at Wellhead, Louisiana, one of the ways we promote and support childhood and adolescent health is through our WellSpot designation program. The program recognizes organizations that voluntarily implement healthy policy systems and environmental changes by designating them as a level 1, 2, or 3 WellSpot. And the goal is really to help these organizations create an environment where the healthy choice is the easy choice. We work with many different types of organizations, but a few types that we work with for WellSpot designation where children spend their time are schools, childcare centers, and also faith-based organizations. And Wellhead offers free technical assistance to help facilities implement these healthy changes and become designated. Here are some resources for you all. The top two, I'll point out, especially the strategies for early care and education and CDC Healthy Schools. For anyone looking to dive much deeper into those two models, the spectrum of opportunities for early childhood and the whole school, whole community, whole child model for schools, these websites, you can really get in there and get a lot of ideas and resources for strategies that can be implemented in those settings.
Thank you so much, Stephanie. That was some really good information. And again, I want to remind everyone to use the chat or Q&A function in the Zoom to post your questions. And we're going to get to questions at the end of this session. So now I would like to introduce Dr. Nicola Hall. She is a Chief Human Resources Officer at East Baton Rouge Parish School System. For almost 20 years, she has worked in food service and nutrition management, as well as human resources, both in the private and public sectors. Her work in the public sector included the New York City Department of Education and City of Bridgeport Board of Education. Dr. Hall holds a bachelor's degree from CUNY New York City College of Technology, an MBA with a focus in human resources from South University, and a doctorate in organizational leadership from Walden University. Please give a welcome to Dr. Hall. Thank you.
Hello, can you guys hear me well?
Yes, we sure can.
All right, awesome. So good afternoon, everyone, and thank you for asking me to speak on this subject matter. Child nutrition is a very fun space for me, very passionate space for me. So I've always dibble and dabble into that area along with HR. So today we're going to cover just some outline factors, just not about what is the definition of being overweight or obese, but what is childhood obesity, which is an epidemic, especially here in Louisiana. I'm going to provide some statistics, some contributing factors, prevention, how can we help, or where do we start? And EBR, Child Nutrition Program, how have we been responding to this? And at the end, we'll have some Q&As to go with that. Okay, moving on, next slide. All right, so obesity is the driving force behind putting children on the road to being psychologically and physiologically detriment. So it is a problem. And childhood obesity, the outcomes is influenced by different factors. So it's not just eating the wrong things. It could also be genetics, hormones, lack of physical activity, parental attitudes, because once again, kids will model what you do, family and home environment and the lifestyles, pretty much. That could be contributing factors to childhood obesity. Next slide, please. So when folks hear about BMI, which is something that scares people a lot, it's just for us to understand what does it mean to be overweight. And they use the body mass index as a threshold to be able to provide guidance as to how, if you are overweight or not, or if a child is overweight or not, or if you're obese. So a BMI above 85 percentile, but below the 95 percentile, that's what's shared out, or shared out to a space where to define if you're overweight. If you're obese, it is above the 95 percentile. So this is just to provide, this is just a guideline for the regular folks like myself, to help to understand what it means to be overweight or to be obese. Next slide, please. What is childhood obesity? So as I said, in Louisiana, we have a problem. We are leading the nation. I'm going to talk more about that, but it is very destructive. It's costly, and it provides and it creates these common diseases affecting our community, especially African American and Latino communities. Childhood obesity, simply put, it is caused by energy imbalance, which occurs when a child consumes more energy than they expend. And it's just based on the things that we are doing, sitting around, not being active, or dietary restrictions, or not just eating the right things, period, and the different type of stress factors. Next slide, please. So there are metabolic conditions that are put, for a number of chronic health conditions. The term overweight and obesity are more than just numbers on a scale. There's a whole definition of understanding what it means to be overweight or obese. It's just not standing on the scale and you look down and you're like, oh my God, I am 20 pounds heavier than I was 2 months ago. It literally aligns to your BMI, which we talked about 2 slides ago. Next slide, please. So here are the statistics that I definitely just share out that is a problem. So we talked about the fact that obesity, especially childhood obesity, is very destructive, it's costly, and it affects our community, especially and African American and Latino. 14.7 million US youths aged 2 to 19 years are obese, right? Louisiana ranks the highest in childhood obesity in the country. We are at 19%, and the national average is 15%. So in Louisiana, the average is 1 in 3 youth is childhood obesity. So this is an epidemic. We are literally facing a real issue, and the numbers have steadily climbed over the last few years. In addition to that, ages or grades 9 through 12, 17% are classified as obese. The healthcare costs for children with obesity could average about $160 higher than costs for children with a healthy weight. So it's just not just looking at the scale and said, oh my God, I got to do something, but it's just the overall framework of we got to get this, we got to get into a better space because it's affecting, you know, not just the day in, day out, but also healthcare costs, which is, we all know is a problem. Next slide, please. So here are some factors, right? The lifestyle, too little activity, too many food, especially bad foods, right? I am not a registered dietitian, but I can also, I'm a very well-versed person, very well aware of what goes in my body. If I put something great in, I'll feel good, right? There are things that we can do day in, day out to make sure that we are doing what's right for kids. So we got to do better. We must do better in terms of identifying foods are the foods that we should stay away from. 40% of daily calories for adolescent ages 2 through 18 comes from empty calories, right? These are added sugars and solid fats. Half of the empty calories comes from soda, which is some people's favorite, not mine, but some folks. Fruit drinks, dairy desserts, grain desserts, pizza, which is a favorite of mine because I love bread, and whole milk. But we could do, there are things that we could do to still enjoy the things that we like to enjoy, but also, take in consideration that we could literally meet halfway. We could have a cup of water and maybe a cup of soda later on. But there's something that we could talk about that later on. Next slide, please. So here's some prevention. This is by CDC, and I inputted the website, so you could go on there and read some more. But here's some things that we could do. Improve our kids' healthy eating patterns by being a role model, right? So I'm a mom of twin boys, and my boys, they monitor or they watch or observe what I eat or what I put in my body, and they will do the same thing, right? So add more fresh fruits and vegetables, calcium-rich foods, low-fat yogurt. Just start doing some small steps as parents will definitely send a message to our young ones. Increasing participation in family activities like jogging. I love to run. So my kids will go running with me. Tag, you know, that's a fun sport or a fun activity. Something that will get you out there to enjoy the sun, enjoy the environment for at least 60 minutes per day. Enjoy making sure that the kids are getting enough sleep, right? So preschoolers need about 10 to 13 hours. If you're between 6 and 12 years as a child, they need about 9 to 12 hours. And, you know, believe it or not, our teenagers, they need 8 to 10 hours of sleep. Reducing screen time, even for us as an adult. I try my very best to, but my job sometimes is a lot to deal with in terms of staying on top of things. But, you know, reducing the amount of screen time, which directly aligns to poor sleeping habit and also weight gain, is a problem. So if we could reduce the amount of time that we spend or our kids spend on screens, we'll definitely see an improvement in the weight issue, obesity issues, and also grades and poor mental health. Supporting different types of obesity prevention programs. So for example, the speaker before me, she talked about the whole child, which I do love because it's a holistic approach model versus a single approach where it's one entity trying to, you know, resolve this epidemic. It's literally the entire community wrapping around our kids. Next slide, please. Okay, so the next step, exposure and access, right, to healthy food. I do know I've been here for 3 years now in Baton Rouge, and the North Baton Rouge, it's not just about food insecurity, which is at a high time high. It's also food insufficiency, right? So there's food, but is it the right food, right? So we have to provide better access and exposure to healthy foods and drive in that factor, help me or help my team or help EBR child nutrition program to revitalize what we've been doing with our menus. So some of those things that we have done is returning scratch cooking with an emphasis on nutritious recipe, right? So, and when we talk about nutrition, sometimes it's boring. It's not as, you know, fun and exciting. It's like, oh my God, I'm eating cardboard kind of thing. And it's reduced fat, reduce this, but we could make it fun and more interactive if we have activities that surround that. So make it more, if you're at home cooking, get your kids involved, making a salad together, talk through what the different recipe items, add whole grains to it, talk about the different healthy oils, olive oil, etc. Adding fresh fruits and vegetables to a salad makes a whole lot of difference. Not only that, partnering with local farmers, community groups like One Rouge Cafe, which I'm a part of. Other colleagues, for example, is also Southern University. They also have a agriculture at LSU, but partnering with them, getting information, exposure, and access to the community so other people could be aware of the things that are there available, but it's just making sure it's exposed and everyone has access, and educate your kids. Once again, the biggest thing, if you take them shopping, encourage them, let them be a part of that discussion. That will help to start changing the way kids see nutrition, and you will start seeing the way things are, the different items on kids' plate. They will start being norm to a healthy eating habits, and eventually you'll see the difference later on in terms of the decrease in diabetes, hypertension, etc. Next slide, please. All right, one of my favorite, diet and exercise. So it doesn't matter, well, it matters if you eat healthy. It is a thing. It's really could make an impact. But if you couple it with exercise, and we talked about the different types of exercise that we could participate at least 16 minutes a day, right? So even if you do a hard, 30 minutes or a quick 30 minutes cardio or 20 minutes cardio, and find some other way later on in the day to just go walking, jogging, playing tag with the kids, or hopscotch, or whatever is so fun and engaging, will help to increase better mood, right? Reduce the level of absenteeism that we have. Being physically fit just not help to prevent obesity, but it also helps to strengthen bones and lower blood pressure and help manage stress. I do know that with me and the type of job that I have, me running 2 or 3 times a week helped me to manage my stress and my anxiety, and also help to build self-esteem, because now you look better, you feel better, and now you have a better outlook in life. Next, please. So the public health response, and we need to create policies, reports to include intentional data, to include problem associated with childhood obesity. So what do I mean by that? And this is where it is a little near and dear to my heart, right? We have a lot of technical jargon that we use, and we don't do a really good job of being simple or simplifying the language, right? To get parents activated, because they're the ones who are making these changes, or will have to make these changes, which starts at home. So I could do as much as I can from a child nutrition standpoint of making changes with menus, etc. But I also need the parents to be a part of that conversation. And the only way, the best way, not the only way, the best way to do it, I think, is to be more intentional about the data that we're sharing. No sugarcoating, drive straight to the point, but make it very simple, right? Talk about the consequences on health, medical costs, economic and social situation that occur, emphasizing the consequences that it heightens when it comes to public and policy making. So whenever we're doing policy or making changes, we need to create this campaign around the need for the attention, the need to get parent engagement into it, focusing on all aspects of the food industry. So just, they're out here marketing to our young kids, right? Not just the obvious that we see soda. Yeah, we know soda is bad because of cavities and bacon, etc. But there are other things that are happening that they're marketing to our young kids. So for example, if you go into a bodega, look where the sugar products are at the very front of the cash machine, right? The cashier station. So it's intentional in terms of the food industry. They want our money, right? I don't have a problem paying for something, but give me healthy choices, give me healthy options, and make it more inviting for me to be able to access. In addition to that, purchasing something, a healthier option, sometimes a lot more expensive than purchasing something that is not, right? A sugar bun may cost 50 cents. Meanwhile, if I wanted to get a salad, it's going to cost me $5. But we're trying to push this agenda that we need to eat healthy because overall it makes us better, feel better, it reduces all these good things, et cetera, et cetera. But at the same time, we, as not just policymakers, but the people who are voicing out our concerns, need to do better in terms of being intentional of where we need to focus on. I talked about simplifying the communication to appeal to the underserved or underrepresented communities. There's just certain things I'm not going to say to a parent who I know is not going to understand the technical jargon of the BMI. I'm going to get into the nitty gritty and break it down. We need to get your child to here, because if we do not get this child here from this precarious situation, this will happen in 10, 15 years, right? Make it more fun, interactive, address cultural foods, right? Because I'm Jamaican and I was brought up in rice and beans and jerk chicken, etc. But I had nutrition education. I had a parent or parents in my household who taught me the difference, what is good and what's not. But don't diminish that cultural foods are still fun and good for you, but it's how we consume those meals. Okay, moving forward. Next slide, please. Okay, this is also a response to the last slide. So healthy option policies should be easy for adults who are caring for young children inside their homes to understand. So anyone who's caring for a child, whether it's a grandparent, a mom, dad, uncle, aunt, whatever, it should be that simple. It should be easy for them to understand. It should not be technical, which is hard for me to decide. How do I make a salad with 3 ingredients versus I could just run outside to the bodega and just go get me some sugar bun and soda. I know they're fed, but is it good food? Is this what I need them to eat? The implementation of new policies addressing childhood obesity, which is an epidemic, and I'm gonna keep stressing that, especially here in Louisiana, must be evaluated, must be supported, reviewed with evidence of ineffectiveness, identify any unintended adverse consequences, and updated to include any new evidence. So I know we get, excited about anything new, but I think one of the biggest challenges and opportunities for us is to make sure that we're continuously evaluating these policies and supporting them at the same time. And if it's not working, we need to pull it back and redo it and rebrand and recampaign and make sure that the conversation or the messaging is getting out to the folks who need to get it in the underserved population and the underrepresented population, so they themselves understand how to interpret the information and educate their kids. Next slide, please. All right, so we talked about the benefits of eating healthy. Here are some really good reasons why, all medically reason why. So it's, high blood pressure, heart disease, cancer, dental caries. We talked about, I've seen little babies walked around, half of their teeth are missing because the food that they've been exposed to. It's just not the right food. So they do have access to food, but it's just insufficient. Not have all the right vitamins, calories, the protein, all the things that a body needs, they don't have. And all of this, yes, eating healthy is great, but not only that, you will look better and you'll feel better, because whatever you put inside your mouth, right? Whatever you put inside your mouth or inside your body, it actually translates in how you will feel about yourself moving forward. So all of this is great, but at the same time, you want to look better, you want to feel better. Next slide, please. All right, so quick overview of what child nutrition has been doing. We do participate in our farm to school. We have revamped our menu to include, yes, cultural food, but also make it fun and exciting and more attractive and appealing to kids. while at the same time focusing on our My Plate, because we are a USDA entity and we want to make sure that we are following the guidelines established by USDA. But at the same time, even though we have guidelines, we could still make it fun and exciting and making sure that kids have access to all the different nutrients that they need every day. Smart snacks, right? Encourage kids to enjoy smart snacks. We're trying our very best to get this information out at the school sites. The principal needs to purchase smart snacks. Kids do really well and they want to promote that good behavior. They should do that using smart snacks versus other, concession foods that are, most times bad. We did a wellness policy, which was approved by the board back in March of this year. And we also have a good food purchasing policy, which also helps us to purchase things locally. And we have been trying our very best. We try to make sure the message is consistent and at times. If there's any concern, we address it right away. But these are the things that we have been doing from EBR standpoint in response to addressing childhood obesity in East Baton Rouge. And that's the last slide. I think that would be questions and answers.
All right, thank
thank
you,
you.
Dr. Hall. Here is her contact information on the screen for you. Again, thank you very much for your presentations. At this time, I believe we do have some cues, some questions in the chat. So I will take a look real quick at some of those. One of the questions is, how do we get our local schools to engage in these changes? Dr. Hall or Stephanie?
So I can start. I could talk about what we've been doing here in EBR. So whenever we make any changes over the last 2 years with the menus, we have went on a marketing campaign, a rebranding campaign, and we are in a space where we are not just sharing out the things that we're doing and making sure that the adults in the room taste test the items that will be on the menu so they know how exciting it is. We're still following the guidelines, but also providing access, fresh fruit and vegetable access. So we have a fresh fruit basket that's displayed every day in every school. So we are driving that health and wellness initiative to say there's a better option versus a Doritos, grab an apple. So this is what we've been doing. It's a lot of work. You got to keep repeating and repeating, but it's just always making sure that we're consistent with the messaging and making sure it filters out as far as we can.
All right, Stephanie, you want to talk about early childhood?
Yeah, I could talk about early childhood and schools too. I think everything Dr. Hall just said is fantastic. And I would just add that it is really challenging sometimes getting schools to engage in this. We know schools are overburdened, underfinanced. They face, competing priorities because obviously they're, on a mission to educate children, right? I think sometimes it means starting at the very beginning with just getting buy-in. That might be finding one teacher at a particular school that you notice is like really into fitness or is really passionate about eating healthy and trying to get them to be a champion at their school for implementing healthy changes. Or it might be going all the way to the top to a superintendent or a principal and really getting them to buy in and value the impact that health has on student achievement in schools. Another good place to start might be looking at your local school wellness policy, depending on what school system we're talking about here, and maybe talking to schools about, asking them what are some of the ways that you're implementing the wellness policy here at the school. And also I'm just going to plug our WellSpot designation program because the school and early, childcare WellSpot benchmarks are a really good place to start, and they kind of walk you through like building support at the school or childcare center, assessing the environment and making a plan specific to that environment, and then providing technical assistance to implement changes. So that's also a good place to start.
Perfect. Thank you. Thank you. I want to encourage participants to actually go to the chat. There's some very good recommendations in there besides just questions for the speakers. So go take a look at some of the chat in there. I'm going to move on to the next question. What programs in school or out of school are in place when the children have an eating disorder? And do they receive the right therapy for them, such as cognitive behavior therapy? And are parents also involved in receiving therapy? I don't know if y'all are able to answer that type of question.
So I can provide some context. We try to do this wraparound. The attempt is to do wraparound services for every child, right? So in child nutrition, we recently added dietitians to our staff, and these registered dietitian, when the special diets come in, which is a doctor's note that is reviewed by the school nurse, is submitted to our office. Registered dietitian looks at that, review it, and then provide a menu, a specialized diet menu for that child. If it has, as long as there's a doctor's order, and we do have that in hand, and it's already reviewed and approved by the school nurse, then we take care of it from a menu standpoint. I am not aware of parents getting support outside of school. That's something that I would have to research if we do provide that. But for a child's well-being, if there's a child with a specialized diet, we provide as much as we can from a dietary need and menu to make sure that that whole child gets everything that they need to function in school.
All right, and the next question, I'm going to kind of switch up the question or reword it just a little bit. What programs are in place that might help a parent with time or resources to show their children how to cook, or to cook with their children healthy meals? Are there any resources out there for parents?
Yeah,
to,
so I mentioned a few. Oh, I'm
no,
sorry.
you go ahead, Dr.
It's
Hall.
okay, go ahead.
Go ahead.
Okay, so I do know of several entities here in Baton Rouge who have these cooking demos. I know, and I could send that information to you, Ms. Corsi, so you could filter it out to the group. But there are entities that are here already in Baton Rouge doing this work. If anyone wants to check out Healthy BR, this is the mayor's initiative. She has a wealth of information that is aligned to healthy eating practices, organizations that are doing that and doing that work. But there's a lot that's been going on. It's the awareness and making sure people have access to this information. So I'll send an email with some intel so you could share out.
Perfect. Thank you. Stephanie, did you want to jump in?
I was actually just going to say that I would need to look around.
Right.
But I do know that extension programs like from LSU Ag Center or Southern University Ag Center, those extension programs usually have a lot of like community outreach and resources to help families and parents. So that might be a good place to look.
I think so too. And what comes to my mind are farmers markets. Sometimes they will do a booth will do a demo on how to prepare a vegetable that they are trying to sell. So also farmers market, and that would be a really fun place to take your child and have them pick out a new vegetable to try. So, okay. What happens if the child is eating healthy and exercising, but still has a high BMI? Do healthcare professionals have guidelines?
I could take that and say, yes, they do. Definitely see your pediatrician ASAP because they have guidelines. I just learned something really cool yesterday at one of my alliance meetings. So that one chart that we all have, if you have one chart, I do. If you go down at the bottom is a resource button that if you click it, it opens up, you put your zip code in there, whatever help you need, and it should provide food access, information for health and wellness, et cetera, et cetera. So the first step I would say is to definitely meet with your pediatrician, discuss the concern, and let them help to facilitate a plan of action. Because I'm not a doctor, but the first place to start is with your physician, because there's maybe something medically that I cannot help to address.
Right. Okay, this one is good. How are they, audience members, how can they communicate this information to their schools or the child care centers about healthy eating, exercise, things like that? And the person that typed the question gives an example about schools that have cut everyday PE classes, have reduced PE to maybe once or twice a week, that kind of thing. So how can a parent, a grandparent, a guardian, or just a citizen approach and discuss these things with their local school? Any suggestions?
I mean, I would suggest either approaching school leaders and asking, what can be done as an alternative, or, some of these things are system level, and every school system is different. So maybe that means going to local school board and, voicing concerns over these kinds of things. With regard to the example of PE classes specifically, it might mean trying to work with schools, or asking schools to find other opportunities throughout the school day to build in time for physical activity. Maybe they can't figure out a way to bring, an hour of physical education class to students every day, then maybe there's a way to build in pockets of time dedicated specifically to physical activity throughout the day. Yeah.
All right. I meant to do this. We've gone through the questions. I believe I've got the majority of the questions, but again, look in the chat. There's really good conversations and chats going on. I believe we've posted some resources in there, some links in there that you can click on pretty quickly. And I'm going to turn it back over to Ms. Avis Richard for some closing comments.
Thanks, everyone. Two dynamic presenters, a wealth of information included in today's webinar. And yes, Nicole, I did post a few resources there in the chat. The first resource was to the community resource guide. And so this is a local driven part of our site, part of the Wellhead, Louisiana site, in which you can search for farmers markets, schools that are centered on nutrition. Some of them even offer tips on diabetes management. So there are several resources in there. Please use that link to go and search for resources local to you. And then also there are several resources that we have on our Well Ahead site with regard to nutrition resources. So School Nutrition 101, there's myriad resources there for you guys. What we will do is we will take the information that's in the chat and we will vet that information to assure that we provide the feedback to you guys, as you guys have indicated in the chat. So we want to make sure we do our due diligence to address all of the questions that are in that chat, and we will compile those and send them out to the group. And we'll also look for space to share this information on our website. So very good conversation, good presentations, and questions. Thank you all for joining us today, and we look forward to having you guys on our next webinar, where we will talk specifically about breast cancer awareness. Thank you all so much for joining us today.
Again, thank you all so much for joining us in today's webinar. A huge thank you to our keynote speakers, Stephanie Hackett and Dr. Nicola Hall. We are walking away today more enlightened and empowered. And to find out more about Well Ahead on our numerous programs and services, please visit wellaheadla.com or contact us at wellahead@la.gov. Again, thank you so much and have a fantastic